Only on Fox's state-of-the-art procedure here in Houston for colon cancer is getting patients back on their feet twice as fast. It involves a fluorescent light and small incision. I went into the operating room at Methodist Hospital to find out how it helped a local man. Houston Methodist Hospital happens to be one of the only hospitals in the country that is offering this now as standard care.
Just one night when I got home from work, I was having shortness of breath. I was trying to go to sleep. I couldn't breathe, and it was really feeling like I was suffocating. And I went to ER and found out I was losing blood somewhere.
Nathaniel Morrow never imagined it would be coming from his abdomen. He was quickly diagnosed with colon cancer. Even though the disease runs in his family, he was surprised it happened to him in his mid-30s.
My dad had it. He had it twice, maybe 8 years apart. His mother had it. Two sisters, uncles, cousins. To give you the exact number, I don't know exactly how many has been really affected by it, but
too many.
Too many.
Dr. Eric Haas is Nathaniel's surgeon at Houston Methodist Hospital. He was excited to offer Nathaniel hope and a new option for treatment.
He came in frightened, he's scared, he's there with his family, and to be able to tell him that you're going to be okay. We are going to take care of you and take the tumor out, and you'll be able to live a normal, healthy life just means the world.
It's a good feeling, isn't it?
It's a great feeling.
Like so many patients before, Nathaniel's family members had to have a huge incision to remove their cancer. Not anymore. Now they're able to go through the navel. Now they're taking it one step further by injecting a fluorescent dye. Take a look at this.
When it comes time to put the colon together, we inject dye, and this dye goes into the blood supply and lights up the part of the colon that's normal and healthy. And so that allows us to know precisely where we can go to put the two ends together to have a successful surgery.
Dr. Haas says this lowers the chance that the patient will have to lose even more of the colon and need a colostomy.
The main advantage of this is before we can just use our eyes, which was pretty good at trying to decide where the good healthy part was together. But this gives us phenomenal advantage of knowing precisely where the blood supply starts and stops to really know that we're going to have a safe outcome in the surgery.
Surgeons had Nathaniel up and walking a few hours after his procedure. He's impressed and relieved he has completed all of his rounds of chemotherapy.
And I thought it was fascinating when my dad had his procedure. He had it at the VA, and they cut him right down the middle. And when I woke up, I didn't know what kind of cut I was going to have, but to know it was only 2 inches in my navel, I was like, that was impressive. And then to know the size of it and everything they had to go through, what they had to take out to get it out that tiny incision, that was pretty cool.
Nathaniel believes a positive attitude can help anyone going through a medical crisis.
God's not going to put nothing on you that you can't handle, and you can handle it. Just get through it, have an upbeat, positive attitude about it, and just do what you need to do. Don't give up, because you can beat it.
And he is beating it, and I was so proud of him for allowing us to be in the operating room with him. And I have to tell you, it is remarkable to see the size of tumor that they were able to remove from his navel with just a tiny incision, and now to see him doing so well. He's ready to get back to work and just get life